Welcome back to the PTCB Top 200 Drug Series. I'm Izzy, certified pharmacy technician with 9 years of experience, 110 drugs covered. Today, episode 11, and we're staying in the psychiatric medication space for one more episode because this drug class is unlike anything else you'll dispense in retail pharmacy. Seroquel, Abilify, Haldol, Risperdal. These are names your patients ask about every single week. The PTCB exam doesn't just test the brand to generic. It tests the side effect that only this class causes, the one monitoring requirement backed by a federal risk program, and the two-generation distinction that organizes everything else. Antipsychotics, 8 drugs, 2 generations, 3 suffix patterns, 1 irreversible side effect, 1 REMS monitored drug, 1 black box warning protecting a vulnerable population, 5 practice questions. Let's go. Here is the framework: 2 generations, and the distinction matters clinically, not just academically. First-generation antipsychotics, also called typical antipsychotics or conventional antipsychotics. The original drug class, developed in the 1950s. Mechanism: dopamine D2 receptor antagonism. They block dopamine in the mesolimbic pathway, which reduces the positive symptoms of schizophrenia: hallucinations, delusions, disorganized thinking. The problem: they block dopamine everywhere, including the nigrostriatal pathway. That is why they cause extrapyramidal symptoms. Second-generation antipsychotics, also called atypical antipsychotics. Mechanism: dopamine D2 antagonism plus serotonin 5-HT2A antagonism. First, it reduces extrapyramidal side effects compared to first-generation drugs. Second, it improves efficacy against negative symptoms. The trade-off: higher risk of metabolic syndrome, weight gain, hyperglycemia, and dyslipidemia, particularly with olanzapine. First-generation antipsychotics, many end in azine, chlorpromazine, fluphenazine, perfenazine, prochlorperazine. The exception: haloperidol does not end in azine, but it is the most frequently tested first-generation drug. Memorize it. Second-generation suffixes: apine, olanzapine, clozapine, ridone, risperidone, or iprazole, aripiprazole. Extrapyramidal symptoms: akathisia, cannot sit still, dystonia, muscle contractions, and pseudoparkinsonism, tremors. Tardive dyskinesia, involuntary repetitive movements of the face. The critical fact: it may persist permanently even after stopping. Clozapine requires a REMS program because of agranulocytosis risk. ANC must be monitored before every single fill. Neuroleptic malignant syndrome is a medical emergency. Fever, rigidity, altered mental status, and autonomic instability. Stop the drug immediately. The FDA issued a black box warning for all antipsychotics in elderly patients with dementia due to increased mortality risk. Ziprasidone, Geodon, has a mandatory food requirement. It must be taken with 500 calories for proper absorption. Question 1. Can the technician dispense clozapine if the ANC is okay, but the patient isn't in the REMS program yet? The answer is, numbered enrollment is mandatory for everyone: prescriber, patient, and pharmacy, before dispensing. Question 2. Which side effect is potentially irreversible? The answer is tardive dyskinesia. Question 3. How many calories are needed with Geodon? The answer is 500 calories. Question 4. Which drug has the best metabolic profile? The answer is aripiprazole, Abilify. Question 5. Does the dementia black box warning apply to Haldol? Yes, it applies to all antipsychotics. You now know 120 of the top 200 drugs. Subscribe for episode 12, where we cover anticonvulsants and mood stabilizers. We'll cover valproate, lithium, and gabapentin. I'm Izzy, and I'll see you in episode 12.